Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Alifya Parekh. She's senior content manager at Health, and Leah Callahan. She's senior content manager at Health as well. Welcome.
Thank you.
Thank you for
Happy
having
to be
us.
here.
Yeah, excited to dive into the upcoming ViVE conference just around the corner. I want to let our healthcare IT Today community know about what to expect and how they can get involved. But before we go there, Leah, why don't you start us off? Tell us a little bit about yourself and health, and of course the ViVE conference as well.
Yeah, so I'm Leah, one of the senior managers here at Health, leading content across all of our events. Health is our leading health innovation ecosystem, bringing together the healthcare community. And ViVE is our counterpart, more in the weeds of health systems. It's purpose-built for health system leaders, payers, and health IT executives. So think CIOs, CTOs, CDOs, and the content that they would want to hear most. So practical insights, peer connections, solutions that actually work in production environments rather than just pilot programs.
Yeah, absolutely. Well, we love it. And obviously the partnership with Chime brings out a lot of those CIOs from
Right.
and health leaders from provider organizations. So that's awesome. Olivia, tell us a little bit about yourself.
Yeah, I'm Alifya, also senior manager here at content team. It's a small, lean team. So with Jody, our head of content, Leah and I, we have certain specialty areas and we put together and curate the entire track programming and specialty programming. So excited to bring it at ViVE this year.
That's awesome. Well, Olivia, maybe tell us, like, if I'm a CIO or a health IT leader at a hospital, a health system, what would you say is kind of the business case for me to attend ViVE 2026?
Yeah, great question. So I like to think of I like to think of ViVE as all of your major players convening in one place. So you have your health system providers. This year, our lineup is very strong as it is for every year that we put our program together. But we have Mayo Clinic, we have Cedars-Sinai, we have Stanford. Then we have your major players. So Aetna, United, Cigna, all of the Blues plans as well. We have policymakers, so HHS, CMS, and a lot of great leaders that we've put together this year. And then tech companies, not to forget, so Anthropic, Microsoft, among many. And then to round that out, we have solution providers and innovators that you'll always find in the audience.
Yeah, I love that, I think this is what I hear from CIOs. They love going to ViVE and events like ViVE because they
Yeah.
get to meet with so many vendors all in one place in a quick way, and then, connect with their peers. Leah, I'd love to hear what are some of the big things people should expect from the content at ViVE 2026? What are some of the efforts that, Alifia described some of them, but what
Yeah.
are some other things they should know about the content that
Yeah.
you have planned?
And something that you touched on just now is saying that these CIOs will be amongst their peers, which I think is a great way to say it. It's people facing the same implementation challenges. So you're really amongst people that you can kind of bounce off use cases with and really come to conclusions. So other big things people can expect, the content will really reflect where healthcare is in February 2026. So navigating AI implementation beyond any hype, addressing trust and governance gaps and data sharing, solving customer service expectations as patients are used to a retail level experiences, and tackling operational realities of deploying these technologies in any kind of complex environment. More specifically, we have sessions focusing on QHIN. We're really excited about there.
Hmm.
We're going to have a startup pitch competition again, which is always very popular. And we'll have the Chime Zone, which they actually source their content from their members. So they send out a questionnaire and their members answer. So it'll really be for the people that are coming.
Yeah. I think that's awesome. It's a good thing you said AI first. If you didn't, I would wonder what was going on. But
Yeah. For
but
us, AI will really be throughout everything. So I mean, it'll also be called out, but it's such a huge topic that you'll really see a common thread in a lot of topics.
yeah, I like to tell people: is there any health IT company that's not an AI company now? think we're at that point almost, that it's a
Yeah.
reality. Alifya, I'd love to hear any other coverage areas or content areas that people should know about.
Yeah, I think when we try to curate and frame the sessions, we make sure to go less theoretical and more actionable. Like, how do you start those conversations and then take them on and build them forward post the conference too? One session that I'll call out, we have Hippocratic AI on, and it's a AI, more of an existential AI conversation on asking what humans are capable of AI, what humans are capable of that AI can't do, as opposed to the opposite. So we always think more short term, but this is really looking at long term. What are the trends that we can tap into that we currently haven't been able to?
Yeah.
Another thing, Scribe Mania is over. So really with data, what is next? So that'll be a big part of the conversation. And we're really intentional about how we curate the sessions too. So we'll make sure it's not a product pitch. And then also we love to have competitors. And this is a big, tough year for the industry. So just looking ahead at what can we expect in 2026? So predictions.
Yeah, it's true. ViVE and, in health as well, you always
Mhm.
work hard to put those competitors, to put the not controversial, but differing opinions, and perspectives
Yeah.
on sessions. So, kudos to you and the team for putting that together and getting them to agree to do it, which sometimes is
Yeah.
maybe the biggest challenge.
We aim for the most productive conversations there can be. And usually the speakers are aligned. So it's not provocative, but productive.
Yeah, that's a good way to describe it. Provocative. Leah, I think there's always a lot going on at ViVE. There's lots of things, sessions and events and all sorts of things that are doing it. Help our health IT leaders kind of navigate all the various content, the sessions, the chime, the agenda, the meetings, the provider
Yeah,
connect
a
meetings,
lot.
right? How can you help them understand how it's all laid out so they can kind of evaluate and best navigate the conference?
Right. So it's all at their fingertips. I'd recommend downloading the event app early so you can sort through all the content, flag what interests you. It'll keep evolving as we get closer to the event. So make sure to go back and check it, and you can schedule yourself. You can schedule every day you'll be at the event. So then once you're there, you'll maximize your time, meet the right people, and really make the most out of your time there. We make it pretty user friendly to go into that application and make it yours.
Yeah. And I heard good news. The food is much closer this year in LA, which I know was a big complaint from a few years back. So that's good news for those that are attending. You don't have to hike as far to the food. It's going to be much closer. So
Yeah,
that's a big change.
food is something that's near and dear to our CEO's heart. So it'll never be far and it'll always be the best quality you can get at any convention center we're at.
I was gonna say I did have to hike to get the food, but it was well worth it in LA. It was the best. I had these garlic fries. Anyway, I
Oh,
still dream about them. So yeah, it was some of the best food I've had at a conference for sure.
yeah. Yeah, top notch
How
conferences.
let's talk about the provider and payer connect a bit. I know that's a big part of the conference. It's something a lot of the sponsors love. We've covered that on Sway Health quite a bit as well. But how does that work for health IT leaders that may want to attend, and how does that provide them a better way to attend? I think it's really
Yeah.
an important initiative, especially with so many provider organizations kind of being hit with budget cuts and things as well.
Yeah, so that's another tool. It's a phenomenal way to make very productive use of your time at ViVE. They're pre-scheduled meetings, and it eliminates any of the chaos of trying to find the right people during the event. So again, ahead of the event, you can browse attending companies. It's double opt-in, so you request meetings, and again, build a customized schedule for yourself. So it's structured networking. And then for the health IT leaders, evaluating any kind of technology investment is an incredibly efficient way to have these conversations with multiple vendors in a short time and the vendors that you're truly interested in.
Yeah. And if you take part, you get a free pass to the event and a stipend, I think, something like that. Is that right?
Yes, for some of our Connect programs, from more of the buyer side, yeah, there's that opportunity.
Yeah. So I think that's important for people to realize, hey, even if you're struggling, your organization
Yes.
maybe has cuts, doesn't let there's some opportunity for you still to take part in a cost-effective way. So I think that's great.
Yeah,
Alifia,
100%.
what would you say are some of the main networking opportunities available at ViVE 2026, and any details on how they can make the most of connecting with the peers, as we kind of talked about previously.
Yeah, so there's plenty of them. We intentionally design and curate the show floor where there's little pockets and you can organically meet people and kind of have conversations. And then we also have our reception. So we have our good night welcome reception that's on Sunday night. That's Olympic themed, and that'll be exciting. And then a closing one on Tuesday. And then in addition to that, we have a nurse reception, and then you'll be able to find all of the other opportunities on the app as well. So I highly recommend taking a look. There'll be something every night for somebody to connect, to network, be involved.
Yeah. I wonder if the vendors will embrace that Olympic theme and all come in with their jackets, almost like the countries have their own jackets and uniforms. Will each of the vendors? Do we need a parade of vendors? Is that what?
Yeah. We should put a jacket in our swag bag.
A walkout song too, for them to get to their booth.
Yeah, lots of options to do with that. I love that. And it's cool because LA is going to have the Olympics, and the Olympics is happening in Italy, the winter one. So that makes a lot of sense. That'll be a lot of fun. Well, as we wrap up, Alifya and then Leah, any final thoughts on what else we should know about ViVE 2026?
Yeah, I mean, we've worked really hard to curate a very intentional program that really touches on the pulse of the industry and the practical challenges we're facing. So we're hoping we can cut through the fluff and kind of create these conversations and maybe have ViVE as a starting point, which is always our intention, to have ViVE as a starting point and then help build those conversations further.
Yeah. Leah, how about yourself? Anything else as we wrap up?
Yeah, I'll add, we have phenomenal content Sunday through Wednesday. There'll be valuable announcements, showcases, pitch events, anything you can imagine. So all in all, I think the best advice is come with clear objectives, but be open to some possibilities.
Love that. Well, in Healthcare IT Today, it's partnered with you all as well, and we'll have our setup in the Media Village, doing our video interviews. So hopefully people will come by and say hi as well, with Healthcare IT Today. So we're excited to be part of ViVE. It's always a great event, and looking forward to a great experience in LA. So thanks so much for coming on, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Leah. Thanks, Alifya.
Thanks, John.
Thanks, John.